Warning: this will be talking about topics that might trigger you. Be aware before continuing on watching and listening to this episode. Thank you.
Hi, everybody. Welcome to another episode of Paolo's podcast. Today we have a very exciting guest, Executive Director of NAMI. I believe it's is it all of the state of Florida? Is it South Florida, Marsha?
We are Palm Beach County.
Oh, just Palm Beach County. Okay.
Yep.
So Executive Director of Palm Beach County, Florida, on the east side of Florida. And NAMI stands for the National Alliance on Mental Illness, and it is a national not-for-profit. And this is Marsha Martino is going to sit and help us and tell you those who are looking for additional help and resources and a little bit more about our not-for-profit, because our main goal is to find strategic partners and refer and help people and guide them along this the medical maze and hopefully speed up the process of any discomfort that you're going through and put a dent in, I believe, this national health crisis. So welcome, Marsha. And probably the best way we could start this is because since I'm curious about it, and you referred to me, if I'm a patient or I have a friend, maybe pick out any scenario, how would I explain what NAMI is and how could it benefit me or a family member?
Great, absolutely. Well, first of all, I'll say, even though our NAMI covers Palm Beach County, there are NAMIs all around the country. There are, I think, 25 just in Florida. So they're all over, and NAMI's programs and services are similar around the country. We have programs and support groups that are developed on a national level, and then they're pretty similar to whatever NAMI you would go to. So our programs and services are all delivered by someone who has a mental illness or a family member. We don't provide any clinical services. We certainly encourage people to get clinical services. In fact, we have a family support specialist who's here every day. And if someone is looking for a therapist or a doctor, a psychologist, if they're looking for someone, whether they have insurance or not, if they call, and also let me say that everything we do is free. We don't charge for any of our services. So someone could call, talk to our family support specialist. She'd ask some information about where you live and maybe what your diagnosis is, what kind of service you're looking for. And then she can help connect someone to a doctor, to a psychiatrist, to a therapist, whether they have insurance or not. So we think that that's really important. But also, you think of any kind of chronic illness that someone would get, and mental illness is a chronic illness. So anytime if someone has, whether they have MS, multiple sclerosis, or if they have cancer, or they have, an injury, the first thing people want is they want to find somebody who had that and like, hey, how was that? What'd you do? How was it? Did you get through it? How do you feel now? I mean, that's the first thing people want to know. These are life-changing diagnoses. So let me find someone who had that and see how they're doing. So our programs and services, again, are delivered by someone who has a mental illness or a family member, and they've been there. They get it. They understand what has happened. And if you've never had a mental illness, or if you've never been a family member of someone with a mental illness, it's really hard for people to understand that. The kind of general population, like, oh yeah, I was depressed. I get that. I made myself get out of bed every day. And they don't get that there are people who are so depressed that they're not getting out of bed. I get calls of people, husbands whose wives have bed sores because they don't get out of bed because they're so depressed. And if you don't understand it, someone might say, well, just tell them to get out, that they have to get up and get, these aren't things that you pull yourself up by the bootstraps, so it's really helpful for someone who has a mental illness or a family member who's dealing with someone with a mental illness to talk to someone who's walked that walk, who has been in those shoes and really understands what's happening. So we have,
Would you say that there'd be like, would your recommendation be, all right, phase one, obviously reach out to a reputable organization like yourself, and then get the guidance. Then you go to stage two, speak to somebody to figure where you go. And then would it be a stage three
well,
and
it
a
kind
stage
of
four?
depends. Sometimes people call themselves and they say, I'm really like, I'm having a lot of anxiety, or having panic attacks, or I can't leave my house, or I'm really depressed and I'm really having bad thoughts. So sometimes people call us themselves and are saying, first time ever since COVID, I've gotten these kind of calls that people say, I have insurance and I know I should talk to someone, but like, how do you find a therapist? Like they never had to find, like, how does one find a therapist? So I never used to get those calls, but now more and more people are really having a tough time and reaching out for help. So sometimes it's the person reaching out themselves. More often, it's a family member who's calling and saying, my loved one is, they lost their job. They're hallucinating, or they're belligerent, or they're punching holes in the wall, or they're threatening to kill me, or they're threatening to kill themselves. I mean, it's a variety of things, but usually by the time someone reaches out to us, Mental Health America has a slogan that they say, before stage 4. So any disease, when our goal is to find whether it's diabetes or cancer, you try to reach that person before stage 4, before it's a critical point in that disease. You try to find them when they're just starting to have symptoms, because it's easier to treat. Mental illness is a disorder that we wait until it is so bad that we can't get out of bed, or our family member is punching holes in the wall. We wait till it is so bad to ask for help, or to reach out for help for a family member. So like I said, often the calls are from family members to say, now what am I going to do? Because my loved one is so out of control. And I tried to get them to go to the doctor. I tried to get them to go to the hospital. They won't do anything. Now what can I do? So we really spend time problem solving with people on how to get help for their family member
Yeah, well,
and
we
for
also
themselves.
discussed like what you're talking about, a situation like that. It's also not just with the patient, it becomes a family disease. So,
Absolutely.
I mean, like for me at my age 50, my parents are a basket case. And so if I had to make a decision, I said, listen, I don't want to tell them how I feel all day because they can't fix me. So that's when I use my therapist to unload and get that. It's a safe place, and I could come back and say, hey, my life is what it is, and I'm working and trying to do the best I can at it. And that's for me, it's been a true blessing to not stop the pain, but to reduce it and work at it. So, yeah. So,
It is an issue that affects the whole family, though, and not just that individual with the illness, but the whole family often becomes very isolated. The whole family's not invited anywhere for Thanksgiving. The whole family's sort of left out. Well, of course, with COVID, things are different, but you find you've got that son or daughter who doesn't quite act normally at the Thanksgiving dinner. And, then, well, people are kind of like, they're afraid. I don't want to invite them next year. And you see whole families really being excluded because they are supportive of their, son or daughter with a mental illness.
do you see the stigma being reduced or changing a little bit, and people a little bit more understanding?
Well,
Because
it's,
our research from our teams says that 1 out of 5 people suffer from
right.
mental illness, right? Does
That
that sound
that
accurate?
number's definitely going up with COVID. That
Oh,
number is
yeah,
shooting
exactly.
through the roof. So it is, there is more talk about it now. People are isolated, people are afraid, people are panicked. So, and it's hard. How do I keep myself safe? There's so much uncertainty, which really leads to instability. So people who have kind of had some depression or anxiety issues, this puts it over the top for many of them. The instability, I mean, we all do best in a stable environment where it's predictable. And I mean, that's the optimum way for us as human beings to operate is, you know, a schedule and stability, and we can vary from there. But boy, with COVID, nothing is stable, nothing is predictable. We don't know if we're going to have a job the next day. We don't know if our family members are going to be alive next month. So it's the ultimate in instability.
Now, is there a restriction, or I don't know if restriction is the right word, but now who you open your doors open to? Is it everything from pediatric care to marriage counseling to?
Well, we don't do any counseling. We do support groups. So our support groups are for, we have a support group for 18 to 35-year-olds. That's a young adult support group. And that takes place once a week. We have a family support group that's for a family member or a loved one of someone with mental illness, and that's once a week. And then we have support groups for people living with mental illness, but they're adults. So over the age of 18, and that's twice a week we have those. We mainly serve adults. We do serve youth. We have mentoring programs. So we have our mentors are people who have a mental illness themselves. They've sometimes had involuntary hospitalizations. They've had treatment. Many of them take medication, but they're all stable now. Some are in college or in graduate school. So they meet, they work individually, or they actually are meeting on the phone at this point, but they talk to people who have mental health issues, and they can really help kind of walk them through what they did, what that person could do to get their situation better. And one of our mentoring programs is for youth that are aged 12 through 18. So we don't really work with little kids. We work with family members of children, but the majority of the people we serve are either adults or parents or family members of adults with mental health issues. Typically, serious mental illness emerges in late teens and early 20s. That's typically when you first, in retrospect, many family members will say, yeah, I started seeing changes like around 14 or 15, but that's such a time of change anyway. We try to think that's kind of in a normal realm, but usually people recognize that something really is not right. It's more like 18 to 24 or so.
The brain is still developing until 25.
It is until 25.
We got the hormones going, so
Yeah.
that's a lot to deal with, right?
It is a lot. There's a lot of change during that time anyway, but I often will hear family members say that their child, their adult child, went away to college, and the parents got a call to come and get them because something was really wrong. And that, you know, that's periods of instability often bring out mental health issues. And so college is about as, you know, suddenly you've left your schedule of home, your meals prepared by someone, a structured day, you go to school, then you're away at college, you know, people are often drinking and drugging, who knows when they're eating, who knows when they're going, you know, everything is just chaos. And that's very destabilizing for people who already may be having some issues.
So I guess then probably it doesn't hurt no matter what the situation is. You wrote an outline of some of the ages you deal with, but even if I had somebody that was below those or didn't really fit the program, then NAMI could necessarily, then if you didn't have the answers or the right fit, you still have the resources to say,
oh, absolutely. We can definitely refer to people who specialize in working with that age group. And it's not just that age group too, that age group with what set of symptoms. So we really know many of the providers in the community, and we can really help guide people better than Googling something. You know, we can really, oh, this is, you know, you need to see someone with this kind of expertise or this, you know, it's not something that we generally know much about at all. And then suddenly, as a family member, we're in crisis. You know, we need to get help for our loved one. They're in crisis. And I don't even know anything about this. How do I learn? How do I find someone? So we can help people even to understand what they need to look for and what questions they need to ask. And often it's not unusual, especially when you're dealing with young adults, there often is co-occurring substance use involved. So that just
self-medication
totally,
is the pain. Yeah.
totally muddies the water.
Yeah.
Then you don't know, you're looking at a set of symptoms that you don't know if they're coming from the substance and or the mental health issue. How do you sort that out? How do you find a provider that can adequately address both? So, it's not very cut and dry. And we try to emphasize to families, the wrong treatment can do harm. An involuntary hospitalization, while they absolutely are often necessary, they're traumatic. People have PTSD from an involuntary Baker Act, an involuntary hospitalization. That's traumatic event for someone.
Right.
So, we try to talk to people about, maybe can you talk your family member into going to see a psychiatrist rather than getting them right into the hospital? Might they be willing to go to an outpatient service? Might there be an alternative to locking someone in a psych unit? Because that saves people's lives. Again, I'm not opposed to it, but if there is something that could be done instead of that, that's the route to go.
Would you be able to, maybe this is an unfair question, to sum it up, so our main objective with this podcast for our audience was basically let them know about NAMI and how it's free, it's a not-for-profit, all the good things that you're doing and what your program has to offer. But since I have to, since you just brought up that situation, and I agree with it 100% and support it, is that it's so important for somebody, and I don't know really how to, if somebody asked me this question, I wouldn't really know how to answer it. So is that the first introduction to therapy or dealing with the mental illness or mental health is to get you don't make a mistake on the first one, because then that could possibly scare the patient away from ever getting treatment. So could you give us a quick summary of saying, you could pick any symptom, depression, let's talk about. My best friend is 25 years old, is very depressed, is acting really dark, isolates, sleeps all day, doesn't want to get a job. What should I do to help him out? And then what would you say, to give me a good example and some other, maybe a story you heard from where they made a mistake?
Well, it's pretty individualized. If someone called me with that, I would ask, are they getting out of bed at all? Are they eating? Are they, have they lost weight? And if, they're getting up to eat and they're watching a little TV, but not doing much, I might say, have you ever talked to them about talking to a therapist? One thing that's good and bad right now is a lot of the therapy is happening virtually, like this over Zoom. That's a little less of a barrier for someone than making an appointment, driving in their car somewhere. Oh yeah, I'll meet, you make me an appointment, I'll meet with someone over Zoom. So, I say, have you talked to them about talking to someone? Might they be interested? Sometimes, people typically know something's not right with them and they know it can't go on long term. So I probably would say, if they're willing to see a therapist or talk to a therapist, I'd say, do you think they might be willing to call us so we could talk to them about, getting more details from them to match them up with someone who might be a good match. If the person is really stuck and they're really not leaving the house and they won't talk to a therapist and they absolutely no, I just leave me alone. I'm in bed. They've lost weight maybe. A good alternative to going, then Baker acting that person and getting them in the hospital, which would be one way to go, is you can call, in Palm Beach County, you can call 211. And that's an information number.
It's just like 911. It's just
like 911, but it's 211.
Okay.
And they connect people to resources. And so you call 211 and you ask for a mobile response. So
now,
there's
this is where everyone, our audience is around the nation. So
around the nation. Well, 211 is national. 211 is national, like 911 is national. 211 is national. The term a mobile response unit, that's a pretty well known. There are most places, but not every place in the country has a mobile response unit. Sometimes it's run by a hospital, sometimes it's run by fire rescue, but mobile response unit, it's a team. It usually has licensed clinicians and sometimes a peer, so someone who has a mental health condition who is an advocate. They will go out to someone's home and talk to that person and their goal is to keep someone out of the hospital. So maybe say, hey, you know what? Look, things aren't looking good. I could make you go to the hospital, or hey, let's get you an appointment. And why don't, I'll help you right now with an appointment and you can go see this doctor. And our mobile response is good. They'll follow back up. Did you go see that doctor? But, the idea being to try to avoid a hospitalization if possible. And if there is a mobile response team, that is their goal, to go out, meet with people who are entering, sort of bordering into actually our mobile, it's called mobile response. They used to call it the mobile crisis team. And then they're like, don't call it mobile crisis because we want people to call us before it's a crisis.
Right.
So they changed it to mobile response team. And again, their goal is to talk to the person and help them problem solve how to deal with this issue without going to the hospital. If they get there and they see this is pretty bad situation and it's not going to go anywhere, they can make a decision that that person needs to be hospitalized, and they can call to have that person transported to the hospital. So they can see, okay, this needs to be an involuntary hospitalization, and they'll make that call and have the person transported. But that's not their first line of defense, because these are people who understand, lots of times when you've not dealt with people with mental illness, you think, oh, good, get them in the hospital. Everything's going to be okay once they're in the hospital. But at least in Palm Beach County, and I know in many areas around the country, a hospital is for crisis, and they stabilize the crisis and then they discharge the person home with the idea that they will follow up with resources in the community. And that may or may not happen. So if you can connect someone directly to those resources without the hospitalization, that's always kind of the first line of defense.
Okay.
So for tragic stories, I mean, I just, again, know I've talked to many people, and I have a son with mental illness, and I have had him involuntarily hospitalized, and I would do it again in those circumstances. It had to be done. But I know the trauma that caused him. I know the PTSD that caused. I know it also kept him alive, but it was at a price. So, I think more and more when people call here and they're like, oh, tell me how I can get my son or daughter in the hospital, we always try to problem solve first. Is there something else that could happen instead of a hospitalization? And for people around the country, I would encourage them. It's very rare that there's a switch and this happens overnight. You see it coming for days, for weeks, for months, often for years. If you see something's wrong, don't wait to the point that it's a crisis. Try to get your family member, get your loved one, get yourself help before you reach that crisis stage. Because then again, you have the possibility that it could be a traumatic situation.
Okay. We're going to be back in 3 seconds for chapter 2 with speaking with Ms. Martino from NAMI. And we'll be back in 3, 2, 1. Just hold on.
Thank you for watching Paolo's podcast. This concludes chapter 1 with Marsha Martino. Please tune in next week, February 10th, for the concluding chapter, chapter 2 with Marsha Martino. As of 2021, CPMHA has launched a new charity GoFundMe, and we strongly encourage all viewers to consider donating. Please consider helping us reach our campaign goals, as all proceeds go towards funding our company and into forming our programs and operations to give those in need access to free resources for coping skills and connections to get them through this national health crisis. The charity GoFundMe link will be posted in the description of all future streaming platform videos. Thank you, and don't forget to check out our company website, cpmha.com. And remember to like, subscribe, and hit the notification bell in order to receive notifications each time we post a new podcast.